Over the last few years, following the COVID pandemic, we were seeing an increase in sickness absence within the organization. So we decided to bring in place a number of well-being programs to support our employees so they can help themselves and stay fit and healthy within the working environment. We looked at what were the key reasons why people were going off sick, and then we decided to bring in programs to support employees. As part of our prevention agenda, the Occupational Health Department provides a variety of vaccinations for staff, health clinics, health assessments, and that is making a real positive difference in terms of trying to retain people within the working environment. Over the past 18 months, we've been working actively with instructors from Halo Leisure, and they come on site and they provide well-being clinics, health assessments, and they run a number of well-being activities for employees across all sites. We also have dedicated well-being champions across the organization who provide support advice and signpost people to other sources of support for their health and well-being. We've introduced Schwartz Rounds, which are facilitated sessions to support the emotional and psychological needs of our employees so they can feel better within a hospital setting. It is very clear that over the last year, we've seen a reduction in sickness absence within the organization. So the mental health and well-being nurse, which is one of the interventions we brought in place, has gone down very well.
Hiya, it's Bryony here. Just phoning up so that we can have a quick review. We introduced the specialist mental health and wellbeing nurse role as within Wye Valley Trust, the #1 referral to occupational health is for mental health concerns. The service is in occupational health, and so the focus of the service is to support the wellbeing of the staff within the trust and provide comprehensive mental health assessment, signposting, advice and support for any employee within Wye Valley Trust. Since starting, I have been assessing staff members who may be presenting with a level of mental health concern or distress, and then providing appropriate psychological interventions or signposting and referring to more specialist services as required. I've also been delivering training for groups of professionals. There's also been an increase in liaison and networking with wider mental health services within Herefordshire, increasing their input for our staff, increasing the confidence to self-refer for specialist support. Since the introduction of the role, there has been self-reporting of returning to work sooner through periods of sick leave, of preventing staff members from taking time off work due to feeling more supported and well as a result of the interventions. And so for the patient groups, they're able to see regular substantive staff supporting them and providing their care due to a reduction in sickness levels and an improvement in retention. Feedback from staff across the trust has been positive. We've seen a 100% recommendation to other staff members for the service. There's been 100% satisfaction with the service, and that's translated in improved outcomes for our staff members. It's truly transformed people's lives and seen them change for the better.
And we also have Freedom to Speak Up champions, and they play an important part in helping employees to speak up about any concerns that they may have. So we have put in place a dedicated staff physiotherapist, and the individual provides tailored support to employees who are suffering from musculoskeletal problems. I would like to say a massive thank you to all individuals employed in the trust who are playing a part in enhancing the health and well-being of colleagues, because we know that if you have fit and healthy staff, that is beneficial for patients. In order to provide excellent patient care, we need to have staff who are fit, who are well, who are healthy. So massive thanks to every single person who plays a part in the entire health and well-being agenda for the Trust.